Hi, my name is Ben Atkinson and welcome to the Functional Health Podcast. I interview some of the leading voices in nutrition and lifestyle medicine, and I will share with you their stories, their expertise and their advice, shedding light on the industry from each of their perspectives to help improve your health from today. This week, I'm delighted to share with you my conversation with Ian Broadley and Ali Jaffe. Ian and Ali are the co-founders of NutriTank, an organisation that promotes the need for greater nutrition and lifestyle medicine education within healthcare training, and also empowers members of the public to take control of their health. So, without further ado, Ian, Ali, welcome to the show.
Thank you so much for having us. A pleasure to connect.
Yeah, it's an absolute pleasure to be here. Thank you.
Thank you so much for taking the time out of your day. So maybe we can start by asking the question that everybody asks, just to orientate everyone, which is, as training medical doctors back in the day, what inspired you both to start NutriTank? And Ali, maybe we can start with you and then move on to Ian.
Sure. So I'm a foundation year 1 doctor. Ian is foundation year 2 doctor, and we met in our second year at medical school. And why we started NutriTank is we both felt the exact same thing. There was a huge gap in our medical education when it came to learning about how to advise our future patients around diet and lifestyle. And we just found it to be very strange and disconnected that within the NICE guidelines, which are the regulatory guidelines that healthcare professionals in the NHS are governed by, that within the spectrum of chronic conditions from type 2 diabetes to high blood pressure to even polycystic ovarian syndrome, first-line management was to offer patients diet and lifestyle advice. And we sat there in our medical lectures, from oncology lectures to cardiology to whatever the specialty, and not once was diet and lifestyle covered, but we would learn straight away the pharmaceutical and surgical interventions. So we thought there was a huge disconnect, and we started to dig deeper into it and realised that there was this huge gap despite lip service being paid to it within the guidelines. And when we were sat in gastroenterology lectures where, nutrition is very applicable, the only real nutrition we learned was the physiology, the biochemistry and the anatomy of the digestive system, rather than that practical application and the brilliant theoretical evidence basis that underpins the nutritional interventions within chronic conditions to both prevent symptoms as well as manage them. So we just thought, this doesn't really fit in with what we're reading outside of medical school. How can we change this? And so NutriTank was born.
Fascinating. And Ian, do you want to add anything to that?
Yeah, I think same with Ali. I think it was just, starting medical school straight after a previous degree in biomedical science, just as you did, Ben. I kind of had done a lot of research, and then coming into medical school really in tune with research, and was also already quite activated towards self-care and nutrition for the importance of our health. And then seeing lots of research that was coming out from America and also the UK on, diabetes remission through diet and other forms of self-care, and this wasn't being put into the medical school curricula, into any of the teaching we were receiving, and also going into being shadowing doctors and seeing that there was basically no input at all into terms with nutrition or lifestyle medicine, going straight towards the medicine or pharmacology and surgical intervention. It was just a huge gap, and it was just, talking to colleagues about it, or students at the time, no one really understood what I was going on about. So I did a lot of talking over the first year, and then after the first year, Ali and I just got together. I think I've stopped talking and started doing, and that's what we've been doing for the last 4 years.
Amazing. Like, you brought up that disconnect, Ali, between what you were being taught in medical school and the NICE guidelines. I find that absolutely fascinating. And to Ian, what you said, I actually spoke to Dr. David Unwin the other day, looking at the low carbohydrate diet and the remission of diabetes. And I was fascinated to see that this wasn't really being put into practice, and he had to do this kind of by himself not being paid to do it, running clinics just to see if this intervention worked. Turns out it did. He's published several papers since then. But it's wonderful and kind of perplexing to realize that undergraduate medical students found this, and you are driving this movement forward in terms of getting nutrition education into medical schools.
You know what? It is really befuddling. We really have no words or understanding as to why we're in the situation we're in, because it's common sense. And, we've known since the beginning of time, Hippocrates said, let food be thy medicine. And it is a little bit baffling, but we just have to work with the space that we're in now. And Ian and I are doers. There's been evidence sitting there for years and years now showing the power that nutrition interventions can have in prevention and management of chronic disease. And it's now all about that action and that implementation of the brilliant research that's been done. So, the disconnect's been there. Goodness knows why, but we're changing that, and we're working with brilliant collaborators on changing that and really driving sustainable long-term change through this new Association for Nutrition curricula. And I know we're going to get onto that now, so I'll let Ian give a bit of background on that, but that has been one of the biggest milestones in NutriTank's work so far, and it was launched literally last month in October. So we're super proud, as this holds the potential for all future medics to be trained in nutrition and to be able to, most importantly, improve patient care by giving patients non-misinformed information. So I'll just let Ian give a bit of background on this new curricula.
Yes, so the Association for Nutrition was given the reins by the General Medical Council, the GMC, to create a new nutrition curriculum back in 2018 for undergraduate medical doctors. And the AFN, the Association for Nutrition, created a working group of many different organisations within the UK who work within the space, work within nutrition, evidence-based nutrition. We were part of that working group, and they asked us initially to give a bit of information on what's going on the ground in terms of what's happening at medical schools, because we'd been quite vocal about the lack of education. So even in the first meeting of that working group, we provided evidence in a PowerPoint slideshow to these working group members on survey data that we collected to show that there was, a couple of hours, students were reporting a couple of hours, maybe, they were saying 3 or 4, 5 or 6 hours in medical school, 5 to 6 years of nutrition training. And doctors who we surveyed said that they were not confident to discuss nutrition with their patients because of lack of confidence, lack of training. And it wasn't the lack of time that they were receiving. So that kind of set the agenda for the 3.5 years since 2018. So it's been developed over those 3 years. It was published last month, so it's really exciting. And it is a gold standard by which medical schools can set their training for nutrition. And it ranges not just from obviously evidence-based providing advice, it's also nutrition on the wards, so clinical nutrition, NG tubes, hydration, and also
sorry Ian, can you clarify NG tubes?
Yeah, nasogastric tube feeding for patients who cannot get nutrition through eating or themselves, maybe ITU patients. So really, really important stuff. So there's a whole range. That was, obviously there was working group members that was their bread and butter. For us, it was actually what we were specialist in, or what we wanted to see more of, was the more being able to talk to patients about diet, about lifestyle. I just want to read one clause from the curriculum, which I think we are most proud of, and that really, the GMC has backed this. Let me just find it.
Take your time.
Yeah. It is here. Okay. Be able to start a sensitive, non-judgmental conversation about weight, food, and lifestyle in a brief consultation within a primary or secondary care setting. And that is a core skill in intervention for doctors in the future. And this, obviously this curriculum that will hopefully be implemented within all the UK medical schools. If doctors are able to do that for their patients in the future, that will really, really benefit patients and, thousands of patients in generations to come. So the next step, obviously, is that there's this great curriculum. The next step is implementation. And we are working from a grassroots approach. We have 22 medical school societies across the UK where medical students are organising educational events, and these students are activated to the importance of more nutrition in their curriculum. So we're using them, we're working with them to highlight this new curriculum to their faculty members. So emailing it to their faculty members, telling them about it so that it's driven up on the agenda to say, these are medical students really wanting it within their course. And we're also working within a coalition, Culinary Medicine UK, the founder and director, Dr. Rupi Aujla, as well as NEDPRO, who you work with, and EREM, who's a research group in nutrition. So we're also working within this coalition of organisations because we're working towards the same mission, and we feel that it's best that this is a joined up force, all working towards the same thing and trying to implement this change, because it's not good that there's lots of organisations all doing their own separate thing. We think it's best that a collaborative approach is used to try and make change happen.
Absolutely, that sounds absolutely amazing. It was just so surprising to me that you said there was 2 to 6 hours of nutrition education within a 5 to 6 year curriculum, medical education curriculum. Absolutely insane. But I'm so glad you're changing this. What has been, sorry.
And just to say, there's about 5,000 hours worth of contact time within a medical school.
So it's not even really a nod to nutrition, is it? You can't even call it that.
No. I think what we found is, obviously it's quite complex. It's not all black and white. It's not all about just the number of hours. It's also about the quality. It's also about engagement and the assessment of it, which is a whole new step, which we're going to be working on. But there are hidden areas within current curriculums that could be seen as nutrition, but they're not. And we want medical schools to kind of highlight these and maybe get dietitians in to teach medical students this core nutrition, which is, a lot of medical schools, 2 or 3 have actually got dietitians in. We're trying to use them as models for other medical schools to adopt.
One of the things which interests me is actually understanding the response that you've had so far, both from a top down, from like a seniority level, and also a bottom up. Ali, I wondered if you could come in on that.
So that was the approach we thought would be most effective, to take bottom up and top down to actually create this change and get it actually into curricula and long-term training. So very early on when we started NutriTank, we took, the millennial stance of, let's be change makers, let's recruit as many like-minded people across the country. And that's what we did through social media and through creating NutriTank branches at 20 plus medical schools in the UK. So we essentially have 2/3 of medical schools with NutriTank branches, and they can really make local change, challenge their faculty, to really include more nutrition within their training. And then from the top down, as most startups are, we wanted to be as disruptive as possible. So we started, shouting out about it in the media, and we got picked up by Sheila Dillon, who is a huge supporter and friend of ours, the presenter of the BBC Food Programme, and she was based in Bristol as well. So she had us on the radio to talk about the fact that medical students claim they learn nothing about nutrition. then that got picked up by BBC News and made a whole headline and was viewed by many. And then that really snowballed into much more exposure. The AFN asking us to join their working group, working with Jamie Oliver. We worked with his public health campaigns team off the back of the Nutrition for Medics television show we did with him on Jamie and Jimmy's Channel 4. And we worked with him and his campaigns team to get an extra clause added into the NHS 2019 long-term plan to increase nutrition and education for staff. So it's been really amazing watching how our kind of lobbying from both, angles, from bottom up and top down, has led to real change, which is what we wanted to see.
Hugely commendable what you guys have been doing. I would like to ask you something a little bit more personal. Like, often people have a story when they become interested in the field of nutrition, either how nutrition has changed their own lives, or maybe they've seen it benefit others. What interested you both to begin with? Or was it just the fact that you realised this disconnect between the NICE guidelines and the medical curriculum itself? Ian, do you want to comment on that first, and then Ali?
So I think I was quite lucky to come from a wider family who were really in tune with the importance of eating healthily for just health and well-being, and also maybe a bit more than just that, also eating intuitively. I think there was even Ayurvedic practice in there somewhere from an aunt, so that rubbed off on me. But then going into that was before going to university first time round. At university, I kind of had it was a student life. I think in my third year, I was probably quite unhealthy, very stressed, not really in tune to what I was eating. And I think at that point, there was a moment where I had to stop and go, okay, I need to change some things. Then I became more in tune with what I was eating. Stress reduction techniques, it really helped me get through my finals. So then when I did apply for medicine, I got in. I was already really in tune to how important it was for, just general health and well-being. And then having had that research opportunities, being in tune with the research, understanding how, I had a really passion for it. I think putting those two together, coming into medical school, I was already kind of activated to it. So it all kind of fed into it just fed into the first year of medical school, and it was the natural place to go to.
That makes perfect sense. Thanks, Ian. Ali?
So similar to Ian, I feel very grateful to have grown up in a family where healthy living was just ingrained into the culture. So I'm first generation British. Both my parents are South African, and my mom's been vegetarian since she was 12. So I was always growing up. I was very fussy eater, but I was always growing up with home cooked meals, cooking from scratch, baking with my mom, lots of vegetables. And I think for me, what got me really interested is I took a gap year before medical school, as I didn't get into medicine first time round. And I went traveling by myself, as a young female, for around 6 months. And I had to really look after myself and, kind of practice self-care before going off to university. And I became so fascinated by all the different cultural aspects of food, the psychological aspects of food, the social aspects of food as I travelled, and also saw the huge health benefits. I spent quite a lot of time in the States. As I've got family then, they're very progressive with functional medicine, integrative medicine. So I began just becoming so much more tuned to the practitioners out there and listening to their talks and research. And I just thought it was incredible. And then when I started medical school, I'm someone who, as I'm sure many people have, had issues with my mental health, and I've suffered from depression and generalized anxiety disorder, and so I'm very open about that. And nutrition was a huge way for me to manage my symptoms, but also have cooking as an outlet to be really mindful and present and not always trying to multitask. So it means a lot to me, nutrition and cooking, for sure.
That's absolutely amazing. And both like quite similar beginnings, I guess, but like went about it in different ways. Absolutely amazing that you went traveling for 6 months. I think we should dive into that off air. We're usually fascinated about that one. Do you see new members or people that are interested in NutriTank at different universities have a similar beginning? Either they've I don't know, had a family which are very interested in nutrition, or they're coming at it like only discovering the importance of nutrition when they start university?
I think everyone has come at it from different angles, to be honest. Some people, like we're nutrition and lifestyle medicine at NutriTank, so we prioritize nutrition because we believe it shouldn't just fit under the umbrella of lifestyle medicine, because it intersects with so many other sectors of society, whether it's agriculture, food industry, healthcare. It's so multifaceted nutrition that it can't just be under that umbrella. But obviously, we run other events around lifestyle medicine. So some students are really passionate about fitness, outdoor swimming. So up in St Andrews, they're constantly doing like boot camps by the beach and going cold water swimming. So people have come at it from all different points of view. People who are very outdoorsy, people who love to gym, people who love cooking, people who just wanted that community and to talk about practitioner well-being as well as patient well-being and the importance of self-care. So we offer so much, as well as getting expert speakers who really trust our brand and want to work with us, come and educate our audience. So a lot of people are drawn to us for different reasons, I'd say.
And you have built a brand that people trust, I feel. Like, I definitely trust the information that you're putting out there. It must be quite hard to maintain that level, though. How do you find that?
We have put integrity and scientific robustness at the forefront of everything we've done, and we since the initiation of NutriTank, we were both researching and making sure that everything we put out there was really science led and evidence based or evidence informed, at least. There's emerging, we can talk about things which are emerging fields and maybe they don't have huge amounts of scientific backing at the moment, but are interesting to say, this could be something in the future. And we've got a great team behind us as well. We've got some fantastic dietitians, nutritionists. Over the years we've had people actually voluntarily say, I'll review, things that you're putting out there. We will review radio statements that you're going to put on air on the BBC News. We'll obviously work with NedPro, which is a fantastic resource of nutritionists and dietitians, and we work with them on joint statements. I think what we always remember is that what we're trying to change is medical curricula and medical training. And who are those guarding that? It's the people who are the most critical. It's the people who are the most... They need to make sure that what's going into their curriculum is the most of utmost scientific integrity. So that's why they're very cautious of nutrition and things that they're not fully aware of or understand very much. They haven't been taught it themselves, so why would they put it into their curriculum like straight away? Everything we need to deliver has to be our highest of scientific integrity.
Yeah.
Ali.
I just wanted to come in there and say, yeah, absolutely agree with everything Ian said, and just want to really highlight a huge value that underpins NutriTank, and that's humility and keeping an open mind and knowing our limitations. We are not the experts. We were medical students when we started this, but we had a really innovative vision of how we can help change the healthcare landscape in the UK, and we got the experts on side to help teach that information to our network. So we never call ourselves experts, but we have the experts within our networks to deliver that, to quality assure the information we're giving out. And I think it's so important to work in an interprofessional way and to know what your limitations are and really try to keep as much humility as possible.
I think that's great what you said, Ali. I think that's like an undervalued thing, like understanding your limitations, right? So you're not overstretching ever. And Ian, what you said with evidence-informed rather than evidence-based, Shimon corrected me on that the other day from NetPro, saying that you need to be evidence-informed because the evidence changes all the time. And I think with nutrition especially, what we know now is going to be different. Well, what we know in the future is going to be different to what we know now, right? So we know the fundamentals now, but those kind of nuances are ever changing. And we know that from understanding how low carbohydrate diets can potentially put diabetes into remission and reverse it in some instances. And the old school way of thinking was a very low fat diet. And we know that there might be multiple ways to skin a cat, multiple ways to tackle a problem, I should say.
I think also just to add to all these interventions, especially you mentioned Dr. Unwin's intervention, there was also, as well as the dietary change, there was also psychology input as well. And I think that's really important to mention because it's not just about the nutrition, it's also about the psychology and behavior of that change, which is as important. And probably, for motivational change and for long term, it's really important.
Yeah, I mean, arguably in some instances more important, right? Because anyone can restrict calories given the will to do so, right? Despite what diet you're on. But understanding what a healthy diet is makes that whole psychological element much easier, in my opinion, at least. And the evidence supports that as well.
Yeah, and I just wanted to add, just bringing it full circle, really appreciate that you clearly trust us and view us as a trusted platform. That's something we've worked really hard on, and why we want to remain that way, and what we hope to do to maintain that trust in the public and with healthcare professionals is remain diet agnostic. So you'll never see us talking about one particular diet. We talk about dietary patterns that are beneficial, and we really try and say that there is no one size that fits all. You have to take into account people's socioeconomic background, social determinants that have led them to food choice, as well as their cultural preferences. And that's how, you can adhere to everyone's needs. And I think we don't see that enough in kind of the social media world of healthcare professionals. Things become quite black or white with their thinking, or not even their thinking, maybe just their expression of their thinking. And I think that's what we really try and do at NutriTank.
100%. It's a spectrum, right? I interviewed Dr. Yael Joffe, who's a professor of nutrigenomics over in South Africa. And that was just eye-opening. And I love nutrigenomics in general, just to understand how our genetics interplay with our nutrition and vice versa, but also understanding how our microbiome can change our individual responses to food. I interviewed Dr. Sarah Berry, who works very closely with the Predimed studies, and Zoe, and that was another eye-opener, understanding that there's so many elements. And when you mentioned dietary patterns, I think it's so important that we look at nutrition in that way over just strict diets, because the Mediterranean diet has so many different facets to it. You can manipulate that diet to fit one culture and do it in many other ways to fit others. So, yeah, basically, long way of saying I completely agree with you. Yeah. I wanted to revert back a little bit. When you mentioned nutrition and cooking was such a big part of your life, Ali, I was wondering, with the general anxiety disorder, whether that kind of experience that you've had has influenced your clinical practice and your idea of a career moving forward.
So interestingly, it has. I'm very set on training in psychiatry. My favourite field is the emerging field of nutritional psychiatry, and that's where I put a lot of my energy into reading the research around that. And so I think from my own experience, and there's a lot of mental illness as well in my family, and I've just kind of, once you're drawn to something, I get put in positions a lot when I'm talking to people who I care about their mental health, and I've just seen that having an outlet that's meditative and where you can be creative, whether that's cooking or whatever it is for you, I think is such an important thing. And having the right nutrients in your diet as well, and having that attitude that it doesn't have to be perfect, we're all fallible, we just need to live, and just being able to take an 80% 20% approach, that 80% of the time I follow a dietary pattern that's beneficial to my mind and body. 20% of the time I don't need to be rigid. And I think being able to have gone through the poor mental health that I have, where like at times I was emotionally eating and all different kinds of things around food, and to get to a really stable place where I can really see the benefits of 80-20, and it's all just quite organic in terms of how I select food and my cooking preferences and things like that.
Awesome. That's really good to know. The reason why I brought that up is I've had intermittent bouts of anxiety and I get it very acutely. But what I've realized is it's normally after a holiday. So after the time you're eating, just maybe not eating well, you're not really focusing on your nutrition. Maybe there's some alcoholic drinks involved. And then after the fact, maybe a week after, I'm more prone to anxiety and less resilient to stress in general. And I don't know what's going on mechanistically there, but it's fascinating to me that if I deviate from a healthy diet, I just become prone to it way easier. I don't know whether you find the same.
That's really interesting. I mean, we're talking anecdotally here.
100%. But this is a conversation.
So from a personal point of view, alcohol has a huge impact on my mental health and my food choices. So I know that when I choose to drink, and I'm much more selective when I drink now, and it's very rare, and it's when I really fancy it rather than I feel like I have to. When the next day, all I want is refined carbohydrates. And of course I allow myself, I give myself permission and all of that. But if I was doing that regularly, that would become an unhealthy pattern and would lead to, lower mood and probably feeding a cycle of anxiety. And so I think we just have to really do what's best for us and hone in on what tools are in our toolbox, to help us with coping with anxiety. I think when you go on holiday, you let yourself go. And I think when you come back to the stress of everyday life, that can also have an impact on, I've not looked at my emails, I've not had responsibilities. I think there's so many factors, probably other than diet as well, comparing like the holiday scenario versus your working life scenario. And, you're quite selfish when you're on holiday. It's a real self-care activity. It's like, I'm turning off my phone, I'm doing this. Whereas when you're living your everyday life, you've got family, job, financial responsibilities that you put on hold whilst you're on holiday, but they all come back. So I think diet probably definitely does make an impact, but our bodies are also resilient. Of course, you can go on holiday and eat whatever you want and, it not have long-term impacts.
100%. You were so right when you were saying there's multiple factors as well that contribute to that. Ian, how can people get involved in supporting this movement going forward?
People can support in many ways. I mean, obviously our target demographic is students, medical students, medical doctors. However, we have such a broad range of people who are interested in working with us. We have got dietitians, nutritionists. So if you're a medical student, please do get in contact. We've got communities in your medical schools across the UK where you can go and actually get involved in running the societies. You can get access as a member to a lot of our benefits. And, obviously it looks really great on your CV and on your future applications. If you're a doctor, same. We're starting a whole new network of doctors across the UK who are trying to enact change within their NHS acute trusts, with bringing in better food and health and well-being options, because obviously the food environment in hospitals is rubbish. So there's loads of great opportunities to get involved in hospitals with the NutriTank. And then if you love writing content, if you love creating interesting content, we've got options to write blogs for us, write Instagram posts. If you can think of a project that you want to get going, bring it to us. We've got loads of interested medical students and healthcare professionals who might be willing to work with you on this project. And if you're someone who's a member of the public who thinks that this is an amazing, we're a not-for-profit community interest company. We don't take a salary, but we are doing everything we're doing for the good of our community, which is a community of healthcare professionals. If you are listening to this and you think, how can I help? Please do donate to us. We've got a donation option on our website, or you can become a member. So I think there is opportunities to get involved with this movement in whatever walk of life you're from, and whatever you can do to help will go a long way. So yeah, get involved, please. Get in contact, get involved, donate to us, buy our memberships. Our memberships will give you amazing access to loads of educational resources, NEDPro courses, our own courses. There's discounts to great food brands on there, health and fitness brands. So,
I'll do is I'll put links to everything in the show notes so people can access them there, including the donation button. So there you go. Fully support your movement. Last question to you both, because I know we're very tight on time today. How should I structure this? How do you see NutriTank evolving in the future, and what are your aspirations? Ali?
So how I see NutriTank evolving in the future is that we are the go-to hub for everything nutrition and lifestyle medicine, and we've become an Amazon marketplace for everything on the market in the educational space, but also in the food industry space. And we become that quality assurance service that, because people trust us, they know that they can use this product, you do this course, and it's credible, it's evidence informed. And we really want to be that brand that brings everyone together, that connects the dots. Working on a farming project at the moment. We work with nutritionists, we work with dietitians. We want to bring everyone together all around food, chefs, schools, you name it, all to make change to the system around nutrition education.
Thanks, Ali. Ian?
Obviously echoing what Ali says, to be the leading
very
hub.
Aligned.
be the leading hub in obviously nutrition and lifestyle medicine, self-care activation, and also to have every single medical school across the UK with a medical student society running lifestyle and nutrition events, and to one day have medical doctors being able to talk to their patients about diet and lifestyle, and for it to be examined on, and for it to actually lead to better health outcomes. I think, this is our mission. So basically that hub leading to real change, leading to better patient outcomes.
Yeah. And lots of TV documentaries about our work. So just watch this space.
Awesome. I will link to those as they come out as well. So Ian, Ali, it's been an absolute pleasure speaking to you today. I think it's commendable what you two have been doing and just how much time you've given to this movement. I wish you the best of luck with everything, and I do hope that we can do this again soon.
Thank you so much, Ben. And for everyone, please follow us on Instagram, NutriTank_official, Twitter, NutriTank_info, LinkedIn, NutriTank CIC. My professional account on Instagram is Dr. Ali Jaffe, and Ian's is Dr. In Broadley. So do give us a follow.
Link to all that in the show notes for everyone as well.
Thank you, Ben. It's been an honour.
Thank you for listening to the Functional Health Podcast. You can find links to everything that we talked about today in the show notes. If you have a second, please consider leaving a 5-star rating on iTunes. It really does make a huge difference and helps get this valuable information out and reach more people. Don't forget to subscribe so you can stay up to date and know whenever I release a new episode. You can connect with us on Instagram, Facebook, or our website, and all questions are welcome. As always, thanks to Josh Aurelia for all the editing, and thank you all for your support.